Hi, everybody. This is Two Sisters Health. I'm Jen.
And I'm Rachel, and we're two sisters talking about health.
Yes,
And
the
uh,
world, our lives.
last week we talked with Dr. Gurpreet Padda
Yes.
in St. Louis, Missouri,
Hmm.
and he was fascinating. Uh,
Fascinating.
so we thought we'd talk a little bit about that interview because I think Jen and I both have thought about it a lot this week. I know I rewatched it a couple times. Um,
I haven't rewatched it again. I look forward to it, though.
mhm.
His
Usually I
background is very interesting.
rewatch it when I go to post it to YouTube and the podcast. Yeah, his background is fascinating, and also the work he's doing, right?
Hmm.
I looked a little bit more at his clinics, and they are true inner city clinics with, same kind time constraints that I have in my clinic, and he's just really making the most of that situation. So that's pretty
He
fascinating.
has and I don't know if it's unusual, but he had such a clear grasp of the way that the macro social context, weaves its way down into how that kind of comes into play in a person's everyday experience. I don't hear, that's actually the stuff of the research project that I've worked with since 2012, is really trying to capture um, how those big societal factors play out in people's lives every day and in their relationships on a really right here in front of your face way. Now, the population that he's working with is um, inner city, as you said, poor, lower education levels. And the project that I work on is more kind of representative of the US. So it doesn't have, the folks who participate in our project are all the way from lower socioeconomic status to wealthy folks. So it's a much bigger swath. Um, it's just interesting to kind of think about that. Really different circumstances
Hmm.
lead to different health outcomes and approaches to healing.
It was kind of perfect for us in terms of the social and the
Right.
medical. He did both. It takes us two sisters to get that.
Right. Yeah, exactly.
Some people it takes a village, others it takes one really motivated. I went to the Low Carb Nation website that
Yeah.
he was telling us about, which I guess is a nonprofit. It's not just a website. And they have a conference in San Diego this month at the end of the month, which I
Mhm.
kind of looked at. I don't think I'm going to make it just because of.
Were you considering going?
No, I mean, I just looked at it and was like, well, that'd be a fun conference to attend. It's not terribly expensive for a conference. Like some conferences are pretty expensive. I thought it was very well priced. In fact, they have a $99 attendance for the whole conference if you do it online,
Yeah.
which
Yeah.
I did consider
Mhm.
actually. And I watched some of the videos, and they made a movie called Fat Fiction. Oh,
Oh,
hey,
Hey, sorry,
hi,
it took me a minute to
Dr.
find the Zoom link. So as soon as I found it, I could get on.
hi,
Thanks for joining us.
Dr. Burton.
Yes, thanks for having me on. You guys are
Great.
Pacific time, so it's 10 o'clock
We
where
are
you are.
on, yeah, we're on
Mm-hmm.
Pacific time, both on the West Coast.
I'm just an hour ahead of you.
Mm-hmm. Well, thanks for joining us.
Yeah.
Yeah. So, we're Two Sisters Health, and I'm Rachel Scott, and I'm a physician assistant. I work in primary
Okay.
care here in Northern California. And this is my sister Jen, and she's a researcher in sociology. Um,
I work
and
for a health and aging, longitudinal health and aging research project. Just to give you
So,
a
so PA and a researcher. All right.
background.
and we've kind of been focusing on trying to provide resources for my patients and others, with ways to optimize health. Since my time in particular is very limited in clinic, this gives a little bit more exploration. So,
How many hours do you
Dr.
spend in clinic?
You mean with each patient or weekly?
Just weekly. Like, how much time do you put in?
Oh, I'm in clinic. Well, right now I'm on a sabbatical, but typically I was working 40 plus hours a week in clinic. Yeah. And I would see upwards of 22 patients a day.
Holy smokes.
Yeah. So I want to introduce you, but I want you to tell us about you. So this is Dr. Kylie Burton. You're a chiropractor, correct?
Yeah.
And you practice.
Chiropractor who gave up the table a long time ago.
Okay.
Oh,
And you
interesting.
practice in Utah from what I was reading, but tell us about you.
So I actually graduated chiropractic school in 2017, which was only 5 years ago. And then, of course, when you get out of school, you have in your mind that you have to do crack backs and necks and just do that for 50 patients a day. I never really did that to begin with, but I got into this virtual world of functional medicine. That was the whole reason why I went to chiropractic school, was because of functional medicine. So I took a lot of functional medicine trainings, a lot of weekend seminars, a ton of certifications, and figured out a way to use blood work that people already have. So CBC, metabolic panel, lipid panel, those kind of things, and read them in a unique way. So that way I could get the results or the understanding of what was going on in the patient's body with the blood work they already have. And it's been huge, needless to say. I could take this complex concept and make it so simplified that I wrote a book about it. So now anybody can go grab their labs and understand how to read them in a different way than we're trained, versus normal labs versus functional medicine ranges, with some patterns splashed in here and there. And I have a podcast as well. So it's called Beyond the Diagnosis with Dr. Kylie. I started it 2 years ago. Like most, not really knowing what we were doing when we start podcasts, but it turned into, I have a lot of practitioners now who follow me. I was invited to take over a practitioner Facebook group that has like 1,500 members in it. Started doing weekly lives in there just after the end of 20. So the end of 2020, because again, the world was shut down. So we had the internet to get us to connect through everybody. So I took over the Facebook page. I had a lot of practitioners asking me how to teach them how to read the blood work, and then more importantly, teach them how to do a virtual practice. So I no longer work with patients anymore, and I purely work with practitioners, teaching them the blood work. So they put that tool in their pocket, and then we build a virtual business around that tool.
That's
Dr.
fascinating.
Kylie, can you talk a little bit about who developed this alternative way of reading blood work? Is that something you trained in with the functional medicine training?
So it's a combination of a lot of trainings, but ultimately, Dr. Datis Karazian, I don't know if you've heard that name, but he does. He's in charge of Apex Seminars and Apex Energetics, the supplement company. They did a lot of trainings for functional medicine in the functional medicine world before COVID. And I don't know if that's not their call to their heart anymore, or they haven't adjusted very well with the virtual world. But he's one of those guys that has 9 trillion letters next to his name. And so his team did a lot of the research on what those functional ranges should look like and why they should look like that about 25 years ago. So I've taken his ranges, tweaked them a little bit based off of the thousands of labs I've seen, dumbed it down to where it's not like I don't need a 5-day seminar on how to learn blood work. I can teach all the blood work in 4.5 hours on my live event. So I just make it so super simple that MDs to DOs to PAs to nurse practitioners to even your health coach can get it. Massage therapists can get it. So it's my goal is with that is to help my own field, because Western medicine has its issues. So do we. We have big time issues too. And to make it so that there's more, not necessarily like voodoo, like muscle testing and guessing, because that's really big in a lot of practices, but making it so that there's some structure to the patient care and the treatment plan, and utilizing the blood work that they already have saves them time, saves them money. And like functional medicine lab tests can take thousands of dollars, weeks to
Totally.
get back. And so it's like, wait, if you have a CBC and a lipid panel and a thyroid panel and a metabolic panel, like, great, let's use that. And let's use that to create the treatment plan. And then the second thing is, I don't know if you guys feel like this, but I've had a lot of people say, a lot of colleagues, thank me if I'm helping them, like giving them a tip about social media or giving them a tip on, shooting them an email or a message just to help them out. They always say to me, well, thank you so much. I feel like we're all each other's competition. And I hate that word. I'm an athlete. I like competition. But when more of us are more successful, more people are getting better. So my motto is now, we're not against each other, we're in this together.
Well, and a lot of people need help, right?
And a lot of people need help, and there are plenty to go around.
And why I initially started this podcast is because I've worked in primary care 10 years. And while I help people every day, I was like, how do I help more people?
Uh-huh.
And that was really what sparked the interest.
Yeah. Yeah. Podcasts, it's my favorite thing to do. My favorite thing to host a podcast, because you're going to meet cool people. You're going to meet people all over the world that have passions like we do. And then just to share the message. And statistically, when people start listening to a podcast episode, 98% of the time they're going to finish. So when you compare that versus the social media avenues, where it's like you have 1.5 seconds to capture their attention.
Yeah, really short.
It's way better, and people get to know you. Like I have people, I'm sure you get this too. Like, hey, how's your 5-year-old? Is he sleeping yet? How the heck do you know that I have a 5-year-old? Oh yeah, podcast.
So you have a 5-year-old?
I have a 5-year-old and a 2-year-old. 5-year-old, he's starting kindergarten next week, so I'm entering the school world. And I'm like, I don't know what it's like in California, but there's 2.5-hour kindergarten here. Who on earth thought of 2.5-hour kindergarten? Obviously not mom and dads who work, because
only 2.5-hour kindergarten.
Yeah.
What? That's crazy.
There's some full day kindergartens and like your charter schools, but they're of course booked out.
Crazy.
Blink of an eye.
In California we have full day kindergarten, or at least where I am.
Yeah.
It's like school in the morning and then a program in the afternoon for working parents.
It should be like that. We live in 2022.
Yeah.
Both parents have to work 90% of the time now.
It's true.
So, Doctor, I want to ask you, because I deal with CBCs and CMPs all the time. And the ranges, of course, of ordinary are huge. So I'm assuming that you have a different range that you've established. Is that
Yeah, and those are the ranges I go back to Dr. Datis Karazian. He's created those ranges. Like I said, I've manipulated them some just based off of the amount of patients and the amount of blood work I've seen in comparison. So for example, let's take the CBC. You have the white blood cell count at the top, right? Now I have no idea what the normal range is. I'm so out of the normal range world. But the functional
like 5
range,
to 10.
what?
5 to 10, roughly.
Okay. So the functional range is 5 to 8 in this case. So anything less than 5 or greater than 8, we're fighting some type of infection. Now, the white blood cell count is not perfect. That 5 to 8 range, I say it's not the greatest sensitivity in the world, because I always want to jump down to the differential portion. And I want to get to those 5 markers that in school I was never trained on. I mean, we were grilled on the iron and the B vitamins through a CBC, but we never ever touched the neutrophil count, the lymphocytes, the monocytes, the eosinophils, and the basophils. And now to me, I'm like, if you have a CBC without the differential, you're missing a ginormous piece of puzzle. So you can tell me the normal range again, but because I don't know. The neutrophil count, I want to see it around 60% or less. Do you have that memorized, your normal count memorized at the top of your head?
No, I don't. I mean, we always do differentials, but I don't have it memorized. No.
Yeah, and I can't tell you either. So 60%, and you're going to see percentage markers versus absolute values, right? We're going to worry about the percentage markers, which is most of the case anyways. unless you're in Canada, then they're mostly absolute values. But the percentage marker, so if you have a neutrophil count over 60%, now we're looking at some type of a bacterial infection, because that's what neutrophils do, is they fight bacteria. So we're looking at cases of, say you see a young mom or a mom in her 40s or whatever, she has chronic diarrhea or chronic constipation. They're teetering on the lines of IBS, Crohn's, IBD, ulcerative colitis, like something along those lines. But that every time she goes and gets a colonoscopy or gets tested, it just comes back negative. These would be your cases of SIBO, like your small intestinal bacterial overgrowth, where you have the chronic diarrhea, the chronic constipation, the bloating, the indigestion, the really bad food sensitivities. And I've even seen a lot of infections, bacterial infections, specifically with joint pains. So possible diagnosis of RA. I had one young mom, she was in her 30s. She had frozen shoulder syndrome, woke up with it. They'd done the chiropractic, they'd done the PT, the massage therapy, the cortisone injections. They tried everything just on the shoulder, and nothing was helping. Well, pretty soon the pain from her shoulder started to embed into all of her other joints. And at 31 years old, she's got 2 young kids, can't even pick them up. So I'm like, okay, along the last 6 months of your life, you probably had some blood work done. Get it for me, and let's take a look at what it says. And her neutrophil count was 88%. I have no idea why the body picked her shoulder, but I cleared out the bacterial infection with some supplement with a supplement regimen, and she's joint free. Her pain is gone in her joints. Her shoulder's back to moving, and it had nothing to do with her shoulder. It was all the internal, what I would call the source of inflammation, was that bacterial infection. So you can look at the blood work in a different way and say, all right, now I always caveat this too. If you're looking at your neutrophil count and it's at 72%, don't go run to your doctor and say, I have a bacterial infection. Can you test me for E. coli or Campylobacter or C. diff or whatever you want to call it, to H. pylori? Because these are tests that are going to come back negative because they're not that bad yet, or they're not that specific strain of that severity. And I always reference, like, thank heavens, because when you have a positive test like that, you are sitting on the toilet for 30 days, right? So it's this alternative way of reading the blood work that can help us find the underlying causes of their symptoms. And ultimately, I like to teach people that when you heal the body, despite the diagnosis, despite the symptoms just go away, and therefore the diagnoses are no longer relevant. Does that make sense on how I take the numbers?
Yeah.
You want to keep going? Because there's a few more good ones I can teach you.
Yeah, sure, please.
So we have the neutrophil count, and then right below it is the lymphocyte count. Okay. Now the lymphocytes, their job is to fight viruses. I can't tell you what virus it is. There's thousands of viruses out there, and a lot of them are good for us. It's just a matter of sometimes they become more active versus non-active, and that's where we get the chronic fatigue cases. So the moms who are like, I have to take a nap if I'm going to survive my night, or I just can barely bring my kids home, and then we're going to go grab fast food for dinner because I have no energy for it, kind of thing. The ones who are like, I get my blood work, it's always normal, yet I feel like crap. Those are these kind of people. And especially if you have Epstein-Barr virus, or if you've ever been tested positive for it in the past, like mono, you'll see this a lot with, 10, 20, 30 years down the road, they're fighting the same type of symptoms, just not as severe. So they go get the lab test done, it comes back negative. What the heck? Well, this is a good way to determine, is my chronic fatigue caused by a virus? That lymphocyte count, I want to see it less than 30%. If it's above 30%, now we're looking at a virus of some sort is a little bit too active inside your body. So your body is so busy fighting it off. And typically, our immune systems don't have what they need to do their job. So you're left with fatigue. You're left with, I'm so busy fighting the inside of me, I don't have much left to give on into my external world. So notice how I did the neutrophil counts at 60. the lymphocyte count's at 30. That's a 2-to-1 ratio, right? And you guys are smart. You have a smart audience. I'm going to teach you this ratio because it's gold. We want to see that 2-to-1 ratio. I get a lot of questions about, well, what if it's low? What if my lymphocyte count is at 14%? Now there's a rule, and I'll get to that in a minute, but let's focus on the ratio here. So when we see a neutrophil count and a lymphocyte count starting to meet in the middle, say your lymphocyte count's at 42% and your neutrophil count is at 48%. When they start to clash and meet in the middle, and we approach that 1-to-1 ratio, now I know that that person, this individual, is fighting some type of autoimmune. So that 1-to-1 ratio is an indicator of autoimmunity. Can I tell you what? No. Do I care? No. Because it's all about going in and helping figure out what's causing the immune system to go haywire. And if the lymphocyte count's at 42%, it's triggered by a virus. That autoimmune system is. Okay. Now, what did you, Rachel? Rachel, you see a lot of CBCs, right? So you can take the same patient and you can look back 2, 7, 10 years and you can trace, like, you know what, on this day, using that 2-to-1 ratio, you probably felt pretty good. It was a day where you could go pick up your kids and you could cook dinner and you even got some of your laundry done that day. Whereas 2 years ago when you took your lab test, that was a week, probably sucked. Like you were probably just dead to the world that week. And you can see those ebbs and flows inside the blood work where you're getting numbers meeting in the middle, you're getting numbers that are like 58 and 27. And it's all about how active is that low grade infection at the time. Does this make sense?
Yes, it does.
Yeah. So then you can start playing the fortune teller now. Like, how did you know that? Well, it's right here in the numbers. So you just have to be able to read them. And then when you go to create the treatment plan, it's like whether you have usually it's the husbands, they're like, I don't know if this is going to work. This money's a lot of money. We've tried many things in the past. They're like, now they see it in the blood work and they're, holy smokes. This is what's been missing. This is why her thyroid's never been able to heal. This is why my wife's crazy. Not the same person I married to 7 years ago. And it just makes total sense to them. And they're like all on board. And then as a physician, we're not guessing anymore. We're not pinpointing, oh, it could be your thyroid. It could be this. It could be your estrogen. It could, like, we don't have to guess anymore. It's all right there in the blood work that people already have. And most of the time their insurance is paid for it. So it's convenient too.
Yeah, that's really helpful. When I'm reading CBCs, the ranges are so big. And I always tell people there's so much that I can't tell you based on these numbers because the blood work just it doesn't give us all the details. One example I come across a lot is like liver and kidney. When people just, their organs aren't working as well. I remember in school, my instructor said, the great thing about the body is we have all of this built-in extra function, right? Yeah. So you're not going to get a positive lab value on kidney or liver that there's something going wrong until only 25% of that organ is working. And so it'll be normal up until 25% function is left. So you've lost 70.
That's a lot of function gone.
Yeah. Which is amazing, right? That's why we're able to live as long as we do, and we can get sick and get better. And, our organs are always in flux. I think it's the liver that is new every couple of months. It's completely new because your body makes a new one. But so that is something that I'm not a functional provider. So I'm really curious in alternative things. I was trained and practiced Western, but I do let my patients know that. And then I usually tell them I can't necessarily interpret the more nuanced values. So it's helpful to hear this, especially the 2-to-1 on the neutrophil to lymphocyte.
Yeah, and that 2-to-1 and the 1-to-1 ratio is so big. Now, I want to jump in just because people will see this a lot too. And you know, they listen to this podcast and they get all excited to get on social media and start telling their doctor these things. And it is a different way to approach it. Um, and not, I don't want to say one way is better than the other, because like I'll
Mhm.
tell people, if you break your arm, don't you dare walk in my office. Like, go see the ER room. That's what they're there for. I'm helping you with the chronic stuff, the stuff that's going hidden that we don't have the tools in that toolkit to find. So when people say, you know, my lymphocyte count's at 14%, what does that mean? Well, you're all five of those values, the neutrophils, the lymphocytes, the monocytes, the eosinophils, and the basophils. All five of those markers always have to add up to 100%. They
Mhm.
must add up to 100%, right? Just based off of what they are. They're white sections of white blood cells counts, or a different way to read the combination of white blood cell counts. So when I think, okay, if lymphocytes are really low, what's high? Because it has to balance each other out. It always has to add up to 100%. And then I'll get, well, my monocyte counts like at 16. There you go, virus. Or my neutrophil counts at 74. Okay, perfect. Like, if it's low, something must be high, and they got to focus on that high. And then the teeter totter will balance out.
So
Dr.
do you have, oh, go ahead, Jen.
I was just, well, you asked first, Rach, because this is a bigger picture question.
Oh, I was just going to say, do you have some general guidelines if it's a bacterial or a viral in terms of safe treatments to employ for patients, like
Huh?
supplement wise?
Yeah, the supplement company I mostly use, they're called Systemic Formulas. I'm in Utah, and I grew up Utah. I grew up in the same house I bought from my parents,
Oh,
which
cool.
was not in the plan. Trust me, I did not want to come back here. But they're 10 minutes from my house. I had no idea until you know, you hire your mentors and you get the right people in your life. And they're like, oh, by the way, there's a supplement company that exists. So I have their supplement company, and they have a couple incredible supplements designed to help the bacterial infections, the viral infections, on more of a blanket outreach. So this
Okay.
isn't like your antibiotic that's going to tackle extreme amounts. This is I mean, it's supplement.
Mm-hmm.
So it's going to tackle it with the herbs and the combination of herbs and everything else Dr. Shane puts in the stuff. But I found it really helpful for your chronic cases of chronic IBS or constipation, diarrhea, bloating, indigestion, um, those kind of things. So I do have some safety nets in so as far as treatment is concerned.
Mm-hmm.
But again, don't just go grab a supplement just because you
Oh,
need it.
sure. Yeah. Mm-hmm.
And don't be grabbing them off of Walmart shelves either. There's a big
Not the
difference.
same quality. Yeah. Mm-hmm. Go ahead, Jen.
I was just going to say, how can people find practitioners who are trained to do what you're talking about?
So I'm
Not
actually training a lot of them, right?
right.
I'm creating a directory on my website. If you
Oh,
go to
that's great.
you go to drkylieburton.com/practitioner directory, there'll be, right now, I think there's about 30 of them on there. And it's just going to continue to keep getting traction and traction. And there are other avenues to learn the blood work like this. I just have my own personal staple to it. But if you talk to anybody who's actually a certified functional medicine provider, and I want to say that with caution, because there's a lot of people who will claim that they are functional medicine doctors and they've attended a weekend seminar. That's a great start. But this stuff gets intense. Like, if we're going to truly find out the root cause of things, and not just a cause, but it's multifaceted. Like, when I hate this question. What causes migraines? What causes, I don't know. It's different in every single person. And typically it's not just one. So my goal is to help people get their bodies and their inside bodies healthy, but not only their physical body, but their mind, getting their mindset and getting the whole aspect of ourselves as humans in check. So go to that practitioner directory. You can, if you want to look in your local area, just check certifications of individuals. If you're seeing certifications from Functional Medicine University, FMU, which is where I got mine. If you're seeing them from IFM, that's like the gold standard. You'll see a lot of Western medicine docs who get into, like, they tend to focus on that community where they're Western medicine trained, but they want to add in this functional medicine component. They have a very rigorous certification schedule. So just check and make sure that they're not just blowing their horn or tooting their toot, but they've got some, as I like to say, expensive pieces of paper hanging up on the wall. Does that help, Jen?
Yeah, it does. It does. Functional medicine is something I think I've only heard in the last couple of years. I feel like I never even heard that term until a couple of years ago. And so I've been for the last, since I've heard this term, I'm still trying to figure out what it means. Is it
It's basically a term saying that we're going to get to the root cause of health. And like I said, there's a problem with that too. We're no different than Western medicine. We have big time problems as well. One of those problems is we like to blame health concerns on one cause. You'll hear that a lot in social media. Well, what's the cause of it? There's no one cause. You look on what causes migraines on Google, you're going to get 5 trillion different answers. What causes infertility? Well, it's different for every single person. That's why there's like no one cookie cutter answer. But then number 2 is, you'll hear this a lot too. Well, I tried this naturopath, or I tried this health coach, or I tried this chiropractor, and they just wanted my money. They just wanted, $10,000 of my money, and I didn't get it. Another problem I'm trying to solve is, let's put more regulations on this, and let's actually use a similar modality, as something that's standardized, because there's really no standard out here. And I grew up in Western medicine, so like me doing what I do now is almost blasphemy. But it's like, you guys have issues, like we all have issues. There's no perfect way to do healthcare, period. Doesn't care. I don't care if you're going holistic, alternative, Western, doesn't matter. Nothing's perfect.
I really liked how you are using the values that are commonly ordered also, because one of the biggest struggles, so I live in Northern California, but I live in a very rural, poor area, and people don't have money to do anything that's not covered by insurance. And the study, like I said, there's such a huge range. So I thought that it was really interesting that you were taking lab values that people can afford. Some of my patients who then go on to see a local naturopath, which I think is awesome, I wish everyone could, they end up spending a lot of money on tests because insurance doesn't pay for it. And while they're all very useful and helping them get to the root cause, it would be so great if we could do some things before all of those tests.
That's why I started the way I started, because I'm in Utah, where moms are stay-at-home moms typically, and they have too many kids for their budget, too big a house for their budget, and how dare they spend money on themselves for their health care. So I started, doing let's try this $300 SIBO test. Let's try this $800 oat test. Let's try this. Like, it doesn't work. People don't have money for it. They're valuable tests, but I had to figure out, okay, is there something that we can use that they already have? And there is blood work. So they already have it. They've already donated the time, the money, and so a lot of it's just like a simple $20 copay or whatever. And then other nice thing too is, I can get blood work from 10 years back. People always say, well, how far back do you want to go? Well, if you were sick 10 years ago, give me your labs from 10 years ago. Let's get it all so we can figure out the puzzles. But that's exactly why, if I had to figure out a different way, was because of the financial resources that, one, people were willing to spend, and 2, people were able to spend within their tight budgets. And then it just so happened that COVID hit and doors opened up wide for me. So
right.
I was doing the Zoom thing beforehand. Nobody knew what Zoom was.
Right.
Now everybody knows what it is. So it worked out
Can
really well.
ask you about a certain test, Dr. Burton? One that comes up all the time in my practice, and especially for women and moms, and as often women gain weight and they're feeling tired and fatigued. You talked a little bit about the CBC and illness. and autoimmune. But what about the thyroid panel, the TSH and T4? And let me just mention one thing about what I understand about thyroid is that sometimes your thyroid numbers can look normal, but if you're not converting the T4 to T3 properly, you'll still feel miserable, even though your numbers look okay. And I've read up a little bit on how to maximize or improve conversion for that. But I'm curious maybe what insights you could share with us.
Okay.
Sorry.
Well, I'll
Thank
draw it in the air. So think about the thyroid as a piece of a system that has three key pieces. Okay. The very top of the food chain is our hypothalamus, part of our brain. The hypothalamus, we're going to call him H for simplicity. And then he talks to P, our pituitary gland. Okay. Now, if you draw a line down the center of your head, this is where your pituitary gland sits. It's like an inch, tiny, tiny little gland. But that gland is very important because it produces TSH, which we all think is the thyroid hormone, but it's not. It's the pituitary hormone. So P produces TSH, which talks to T, the thyroid. Okay. So there's a lot of different ideas out there about what that TSH range should be. I like to see it between 1.8 and 3. That's my ideal range. Now, you have to take into consideration medications and a whole bunch of other stuff. But if you put that in TikTok, it will go viral because people will tell you what their TSH is and get some heated discussions going on there. So 1.8 to 3 is my ideal for TSH. The thyroid, right, produces T4. Free T4 is the way I prefer to see it inside the labs. And I always get these mixed up. I'm pretty sure it's 1 to 1.5 on T4. T3 is, I think, 3 to 4 off the top of my head. But ultimately, the thyroid produces T4. So if we have an issue with, say, autoimmune disease, where we got Hashimoto's and the immune system is attacking the thyroid, you might see some fluctuations in its ability to produce T4. T4 has to get converted into T3 in two places, the gut and the liver. So there's your answer, Rachel. If they're having a hard time converting T4 into T3, we have gut problems and our liver is overburdened. Does that make sense?
Yeah. So probiotics maybe and milk thistle or something to help.
It can help. That's where when I get into a thyroid patient and they come like, oh my gosh, my thyroid's problem. I always want to see the CBC too.
Mm-hmm.
Because if we look at the H between the H and the P, let's say our pituitary is producing TSH and the TSH is 0.04. So it's low. It's pretty much basically gone. Then I have to say to myself, what is causing the pituitary to really struggle producing TSH? And there's really two things for that too: stress and inflammation. Well, you're a busy mom. Jen's a busy mom. I'm a busy mom. Don't go telling busy moms that they need to de-stress their life. It's not going to happen. So I always approach to them that, you know what, let's find the stressor on the inside of your body. And when we can find the stressor on the inside of your body, chances are it's also what's causing inflammation. So now we got two birds with one stone. We get rid of that stressor on the inside of your body, and now your body can handle the external stressors a lot better. Your pituitary is producing TSH at a better rate, which then produces T4 at a better rate, which the whole entire cascade happens.
Mm-hmm.
So someone who's listening to this or comes to you with thyroid concerns, you can really say to them, okay, your thyroid is just one piece of a system, and your body is made up of multiple systems that integrate together. So if we can figure out that internal stressor, which is typically an underlying infection, a virus related, especially when it comes to thyroid, to help your gut. And by helping your gut, I want to say, let's make sure that you're having regular and consistent bowel movements. Like that's my big marker. Yeah, you can do a GI map and you can do a whole bunch of really expensive gut tests to figure this stuff out. But let's make sure you have regular daily bowel movements, not like food sensitivities. You're not reacting to, something that you ate at dinner at Friday night, and now you're bedridden for 3 days or whatever it is. Let's just make sure we've got the gut in a good spot. And then do we need to support the liver? We need to support it as let's remove some of the toxins you're using in your home, whether it be skincare, cooking products. I mean, I'm in Utah where you guys are in Northern California, so maybe fire season could be bad. And you got the smoke in the air, and we're breathing it, and the toxins are all in our bodies. And now our liver's like, I can't handle everything. So just help out the liver in those ways. And ultimately, when you're doing that, you're still treating the thyroid because it's all correlated and intermingled.
Yeah, that's great advice. Mm-hmm.
So in my world, people do entire practices off thyroid patients. And the thyroid patients, they want to have quick fixes, right? Let's just put me on thyroid medication, T3, T4, let's figure that out. Well, the real reason why that doesn't work in so many instances is because, again, it's just one piece of a system. And when we can heal the whole system from top chain down, if we go one piece higher, what starts the hypothalamus is our serotonin and dopamine. So now if our body can't use serotonin and dopamine efficiently, now the entire cascade's really screwed up. And it's the T4 is just the bottom of the totem pole.
This is kind of reminiscent of last week. We interviewed someone and we talked about how antidepressants don't work long term, and his experience, and that more studies are showing that. And it has to do with, he says, the gut biome and getting everything in balance, because a pill is only going to work for so long if you're not supporting the whole system.
Yeah.
So
and our gut is responsible for producing serotonin and dopamine. Like 95% of our production of it comes from our gut. And we're just barely skimming the surface on what we deem as the microbiome. The bugs that make us who we are. So
and shocking,
it's just all like we're multiple systems, and our bodies are, like you said earlier, incredibly amazing at what they do.
It's difficult for me as a provider who has about 15-20 minutes with patients. And I find that people don't know how to cook or eat. And how do you teach people how to cook in 15 minutes, right? So maybe yeah, starting there, I guess. And also finding out what foods are affordable for people if they're on a fixed income or a budget, because bad food tends to be cheap.
Bad food tends to be cheap. And if you think about it this way, I'm either going to pay for medical bills or I'm going to pay for food. I'm going to pay for it at some point. I'm either going to pay the medical bills or I'm going to pay my food bill. Take a pick.
Right. Yeah, that's a really good point. Could you speak, if you have time, could you speak a little bit about the CMP? Those are probably the big three I deal with: CBC, CMP, and thyroid.
Thyroid, yeah. So the CMP, I like to focus on your kidney, your liver markers. There's a fun one in there, sodium and potassium too. Those can be fun too. So let's focus on the liver markers, or ALT and AST, right? I don't know what your normal ranges are, but your functional ranges are 10 to 26 for both of those markers. Ideally, I want to see it floating around 10 to 15. And to me, it's not a liver function problem. To me, it's like a status of how overburdened is my liver. I have seen those enzymes in the 200s, in the 300s, and I've seen them at 9 and 10. And unfortunately, those instances where they're way off the charts, I have to talk to the patient about, like, usually it's the very first time they've ever seen it. And they say to me, why didn't the doctor tell me this to begin with? And like you said, Rachel, one, they're very limited on your training with it and what we do with this blood work. But two, why would they point something out if they don't know what to do with it? Because you say to them, well, my AST marker is at 274. Okay, doc, what do we do about it? I don't know. So why would they point it out, right? My world, it's people are big into detox. I don't get into detox as much because by the time people get to me, they have tried every detox under the sun. I just say it's a liver functionality, a liver overburden. So if I'm seeing something above 15, I'm really gonna start caring if it's above 26. Let's support the liver. Let's give it a few supplements to support. Maybe we need to do uh more so of a detox. I'm not so big on liver cleanses. And the
Mhm.
reason why is like people will, they'll celery juice for 3 days straight or whatever the new thing is. And that's great. It's relieving the burden from a short time for your liver, but you're not giving the liver any ingredients it needs to do its job. It needs glutathione in high levels. It needs antioxidants. It needs pieces and I just say ingredients to be able to get things through the detox system. So a liver cleanse, if we're just juicing, yeah, we're removing some burden off of the liver for a short time, but we're not giving it anything it needs to do its job in the long run. So rather than thinking about it as a detox, think about it as here, liver, here's everything you need. Keep going. You got this. You can do it, kind of thing. So that's my AST, ALT markers. Kidney markers are things like BUN and creatinine. I don't know them right off the top of my head, but again, I correlate those as it's not necessarily a kidney problem. It's
Mhm.
again, the kidneys are part of the detox system. Are they overworked? Are they overburdened? Do we need some support with the detox system? That's the way I approach it. So then the final one would be that I could mention is the sodium and the potassium markers.
Mhm.
And we could spend an entire day on a seminar about the mechanism behind all of this. But your sodium and potassium markers are correlated to the adrenals. And a lot of people will say, well, it's because my adrenals are fatigued. I'm just tired because my adrenals, right? Which are these tiny little glands that sit on top of your kidneys, and they produce a very important hormone called cortisol. And cortisol is our stress hormone. You can actually bypass an adrenal panel if you so choose. The salivary panel is the best for the adrenals, but these two markers, I don't have them off the top of my head. Oh, they're right here. So if sodium is less than 135 or greater than 140, you got a big time adrenal problem. And it's like the white blood cell count. It's not conclusive. It's not like the greatest sensitivity. So I like to say if you're sitting on the border, say you're sitting at 135 and 140, and you have all the symptoms of adrenal fatigue, just help your adrenals out anyways. It's never a bad problem to help your adrenals out. Look at the world we live in. Like,
Mhm.
let's just help the poor little guys handle our stress. So then potassium is the other marker. And the potassium range is 4.0 to 4.5. And so again, anything less than 4 or greater than 4.5 would be a sign for me of adrenals. So just some fun stuff to look at things and
So
try to
what would
see
be
it.
a practical intervention to help your adrenals?
I use the supplement called GA. It's an adrenal adaptogen by Systemic Formulas. There's a popular herb called ashwagandha. You'll hear that one a lot.
Mhm.
I don't get into the individual herbs much because then you start seeing supplement shelves very long and extensive. Like people are buying duffel bags full of supplements because of the one ingredient factor. So I like to find a supplement that's a combination, but just about every company out there has an adrenal adaptogen. And I
Mhm.
say adaptogen because um, it will adjust the cortisol level depending upon the need of when you take it. So say if you were to take the supplement in the morning and your cortisol, if you have I mean, unless you're like me and you just don't like mornings, you're going to be slow anyways, no matter what the cortisol level is. But your cortisol should be high in the mornings and then drop down at night so you can fall asleep. So your adaptogens will raise it up if needed or lower it if needed, just depending on what point of the day you are at, what your levels are at naturally. And that's what I recommend. An adrenal adaptogen like GA is one of my daily things. Like I'm not a supplement taker, but I
Mhm.
will take an adrenal adaptogen and I will take a blood sugar stabilizer because if I'm going to heal my adrenals, I have to balance my blood sugar at the same time.
Do you take that in the morning then?
I prefer to take it at night. I take 4 GA at night because it helps me fall asleep. So another symptom of adrenals are me, you know? I lay down in bed at night and I'm extremely exhausted, but my mind is going a million miles an hour. That would be a sign of adrenal fatigue.
So common.
Mhm.
Yeah. It's shocking to me how many people take sleeping pills, actually.
Uh-huh. Melatonin at high doses. Yeah, I was told one girl took Benadryl for like 15 years of her life to sleep. And I'm like, oh, let's
And now there's research to
transition off of that.
suggest that can lead to dementia, chronic
Sure.
menstrual use. Jen, do you want to ask any questions, Dr.
I
Burton?
wanted to remind Dr. Kylie to let people know, as a patient, not a health practitioner, please remind us how we can find your website, find practitioners who know how to do what you do. I know the directory on your website is growing. One question for you. So let's say you live in a small town somewhere where there are no practitioners. Is this the kind of thing that you could take some blood work that you have, get the electronic record to a practitioner remotely, and do an online consult with some, is it?
Yes.
Yeah.
Yes, but Jen, I got something even better for you. I wrote a book. So now anybody can go grab the book and read their own blood work.
Hmm.
So it doesn't matter where you live in the world, go to Amazon and find why are my labs normal, and I will literally walk you through the CBC, the CMP, the lipid panel. I don't get into the thyroid panel because it's more complicated than I can make simplified, but I teach you it all. So rather than having to rely on someone else to read your labs and another consultation, you can be your own lab expert.
Awesome.
That's great.
Yeah, thanks for writing that book. One of the things Rachel and I feel is really important in what we're doing is helping people figure out how to access all of this expertise, and
Yeah.
not for too much money, as much as
Yeah.
possible.
Yeah.
Not
So
that
I
we,
have,
not that we don't want to pay experts for their time and expertise 110%, but as you know, not everybody can. And so how can we get it all out to folks who don't have as
well,
much?
we're helpers.
Yeah,
That's who we are. Like,
that's
that's why
true.
we got into this field. So
Mhm.
it's like helping everybody as much as possible, which is another reason why books are helpful. You can grab it for 20 bucks and learn what took us years of med school to learn. You can learn it in 20 for 20 bucks. And then the other thing is I have a podcast as well. So Beyond the Diagnosis with Dr. Kylie. And we really dive into the blood work even more on that podcast.
Good.
Is it both practitioner and patient friendly as
Mhm.
far as level of, yeah, great.
Yep. Yeah, every Tuesday episode on the podcast is for patients and just anybody in general who wants to learn. And then every Thursday is geared more towards your practitioners. But that's more like mindset and business and things like that, and how to grow your own private practice. Yeah, Tuesday episodes are perfect. I bring in experts as well. So you get more than just me.
Well, you've been extremely helpful. Thank you.
Mm-hmm.
I definitely appreciated all the wisdom and insight you've given us on normal lab values. It's really helpful.
Yeah. There's a lot that you can be done. I always say the CBC is the lab test worth the price of gold if you know how to read it right.
hmm One of my struggles now is trying to find ways to, a lot of times, like with the liver, because we see fatty liver, we call it fatty liver disease in Western medicine a lot, which means your liver enzymes are elevated, but not enough to warrant any big treatments, really. It's lifestyle management. And typically it's being overweight, eating a poor diet, not getting enough sleep, all of the lifestyle things. And that's hard because even if you do bring your patient's attention to it, they say, well, what can I do about it? And it's like, well, you got to change your whole life. How do we break that down?
That's where we get into, you're gonna pay for this in medical bills, or you're gonna pay for this in other ways.
Mhm.
I would prefer to pay for it with a little, and you don't have to like go completely. I don't eat all organic. I don't mind. I still have my chocolate here and there. Like, You don't have to be perfect. I don't want you to be perfect. And I still want you to love life and live it. But at some point, you have to realize I'm either going to pay for it in my lifestyle or I'm going to pay for it in the medical bills. Which
Yeah.
do I choose?
Hmm. You have to choose because
Yeah.
otherwise you'll get sick and then the choice is made for you. In my line of work, I see a lot of people who come in because they didn't choose to clean up their lifestyle and now they have the option of being sick. And usually those people will finally clean up their diets and health habits, but sometimes it's too late.
Yeah. And not to mention, we can talk about lifestyle all the time, but we have our brain's pretty powerful. I just
Hmm.
got back from a weekend retreat in Florida, and it was all about mindset and up leveling. And literally, you can create what you want to create in your brain and make it a reality. So we have to look at the world of chronic illness and everyone, because I know people who eat perfectly clean, have the best lifestyle, but yet they're still really ill.
Hmm.
One is what's going on in their brain. Does being sick serve them? I've had people say, well, I can't afford this because I'm on disability. Being sick serves them. They don't have to work. They don't, so there's that component to it as well. But then the environmental component where you can do all the right things, but if there's mold in your environment, nothing you try is going to help you feel better.
Yeah.
So sometimes people have to leave their environments. And the way you know this is, say you go on a vacation to the beach or to the mountains or wherever it is, and you feel better on your vacation. Then when you go home, you start feeling the same crap again. Is your home making you sick?
I see this a lot with pets,
Mm-hmm.
particularly cats.
Yeah.
People who have a lot of respiratory issues and they go on vacation and they'll say, I think you need to get rid of your cats. They're not going to get rid of their cats.
Well, and they've chosen the medical bills instead of the lifestyle route. But even here in Utah, where we have the four seasons, in the spring and the fall, I had one little boy, his weirdest, well, he was like 14 years old, but his knuckles would become really swollen
Mm,
in the springtime to the point where they wanted to diagnose him with JRA,
mhm.
juvenile rheumatoid arthritis. And I was like, I'm just not buying that. And then it would disappear in the summer. And I told his mom, I said, I'm just guessing here, but when the ground unthaws and the leaves on the trees unthaw that have fallen on the ground, that's mold. And mold is in the air. So I said, the only way we're going to know is if it comes back in the spring. Sure enough, it came back in the spring a year later. And so now we know that it's not that he has RA and his joints are becoming arthritic. It's more of the inflammation that the mold is causing when he breathes it and brings it into his body.
So are there
Along the coast, it's the same thing along the coast when you have the humidity coming off it's just
so are
house.
there supplements you can take to support against mold? So he just in the spring takes certain supplements?
I help out with the detox system,
Hmm.
but to truly handle mold, especially if there's like mold in the home and the walls, uh, there's a it's a pretty
Hmm.
rigorous route to handle
Probably
mold.
moving is easier.
Moving is easier. And even then you got to check. Like there are testing kits from labs where you can actually test your home environment and send it off to the lab. They can tell you how much mold is in the air because it's all there. It's just a matter of quantities and types. We call it
Hmm.
mycotoxins, but those mycotoxins are basically the gas that the mold produces, and then we breathe that gas. So you can do all the right things and cross your T's and or cross your T's and dot
Totally.
your I's, but
That's a
there's
really
a
great
it's
point.
multifaceted.
Hmm.
There's so much that can impact us, not to mention like Jen's drinking some water. That water might be full of toxins, like in the red, in the red soil we live in. I mean, it's really high in arsenic here in Utah. So just expect that you might have some heavy metals you're drinking in your water too. Like there's
What are you
so
gonna
much
do,
to
right?
go. There's so much
Yeah.
to go around. So, but don't get overwhelmed by it. Just pick. For Christmas, I wanted an air filtration system in my home, and I wanted a water filtration system. So those were my Christmas gifts. And that's what I like, that was what I wanted. So you just have to pick a few things here and there. I haven't jumped over to the cooking stuff yet. I don't order all organic food. I'm not quite sure if I believe in that, even though it's organic here versus organic in Europe is just a very different standard. So just pick a few things, like pick 3 things that you can improve in your lifestyle now, and that will have tremendous impact in the long run.
Right. Everything matters. And
Yeah.
usually illness is a culmination of multiple things.
Yeah, and if you're in a rural area, I mean, are there a lot of cows in the area, farmland?
Yeah, especially where I
Yeah.
live. Hmm.
Yeah.
And we're on a
My
well. Hmm.
and doing a well?
Hmm.
Yeah. I have a lot of people with well water, and it's like, oh, can we filtrate that in some sort? But at the same time, that might actually be better than the fluorinated
Right.
water we drink with tap water. So who knows?
We're
It's
up
just
on a hill at
uh
kind of the foot of mountains, so probably our water is fine. At the bottom of the valley floor is we're not part of the main water supply, even with our well. So that's
yeah,
good.
my husband and I bought some property in Idaho, and that's this kind of the same thing. Was It's up on a hill, but I told him, I said, if we're building a house here, we're putting an entire home filtration system in this, because the heavy metal count in the soil is
Wow.
just so high, it's not worth it.
Yeah.
But again, that's a step in the future. Like, I'm no perfect person right here. So I just
Mhm.
have like an air filtration system from Austin Air in my room, and in my little girl's room. She always coughs at night.
Mm.
So that's helped her with her
Good.
coughing. If we were to give her a diagnosis, that would easily be called asthma. And I'm like, no, there's stuff in our home. I'm just in the position right now to, remediate the house, or
Mm.
I prefer to move. I'll move in the next little while. But
Yeah.
so just understand that, yeah, we got the blood work, we got environment, we got mindset, like it's all part of our human bodies. And
Mhm.
yes, they're incredible because we're dealing with this all the time. And look at how well you do function even when we still deal with this all the time.
Well, we really appreciate you taking the time to speak with us.
Thanks for having me.
It's been very helpful, and I really appreciate your simplified, balanced approach. It makes it very approachable for people and
Yeah.
easy to understand, and that's so important.
Yeah.
So thank you.
And I've had recent blood work, and I'm going to buy your book. And I'm going to
Okay.
have Rachel go through my blood work again with your book. I'm not kidding about that.
Okay.
Yeah, and
Do it.
I'm gonna read your book too. So thank you.
Yeah. Do it. That's why it's there.
Perfect.
Thanks, ladies.
Thank you, Dr. Burton. Do you have any questions for us?
Keep doing what you're doing. Changing the
Thanks.
world one person at a time.
We appreciate that. You have a wonderful day. Thank you
You
so
too.
much.
Thank
See
you
ya.
again.
Pleasure to meet you.